Hey guys, no, this training is not over yet. I'm adding one little topic, very important for the future, for your comprehension of what motivates me to share with you all of what I've learned by self-relieving, but also by teaching others, by putting my hands on and bringing all the pieces of the puzzle together to create muscular hygiene and the KISS method, the anti-pain KISS method. So you can become pain expert just like me. So this one topic I'm adding today is entitled the broken system. What are those two numbers here? 250,000 and number 400. Why those numbers? What did he mean? Did you know how many deaths caused by medical errors there are in United States alone each year? Yes, you guessed. 250,000 deaths caused by medical errors. What is the 400 then? The number of suicide committed by doctors or medical students every year in the United States. And in Canada, you divide by 10 because we're about 1/10 of the population that you guys are in the United States. So it's about 25,000 deaths caused by medical error in Canada alone, and about 40 doctors committing suicide or students in medicine committing suicides every year. That's major crisis. Along with, we talked about that earlier, the opioid crisis all over the world, and on and on and on like that. And so many diseases not being explained, Do you know what means idiopathic? When you say it's an idiopathic pathology or disease or pain, idiopathic means unexplained, left unexplained. So, and that's why we're going to talk about biomechanics and about what you and I do as body workers, massage therapists, hands-on or no hands-on, and how powerful working with basic day-to-day biomechanics what it can bring to the system, and how we should get much better status and recognition for what we do with the healthcare, and be part of the official healthcare system and be recognized as very important, because I'll explain to you later a little topic about what I call the high five functional planes in another training and the troubleshooting list. So just to make it simple now, I'm telling you what we do should be on top of the list. Biomechanics, accessing human body health and making it better first ranking first should be day-to-day biomechanics. Why do doctors in the last 20 years, since 2000, they might not always advise their clients as such, but when people have mental problems, like when they have burnout or stuff like that, depression, the best natural advice from a doctor to a patient is moderate exercising 5-6 times a week. Not going to do Spartan races or boot camp and stuff like that, not high intensity training, but moderate exercising, walking, making those muscles, activate them so blood flow is better, and it changes, biochemistry, neurology, it helps everything in the body and in the mind. So, and what is the best advice also for any cardiovascular problems? Again, in the last 20 years, the best advice, doctors, they used to say, I was born in the 60s, so in the 70s, 80s, 90s, we were hearing always doctors advising patients when they had cardiovascular problems with some pills and change their diet. So now they notice that that's not, diet is not the most important factor of cardiovascular problems. It's the lack of physical activity. So now the best advice to give is move, get that body moving, moderate exercising. And they very specify moderate exercising, not go crazy. Progressive and moderate exercising, you better do just like, nobody will brush their teeth for 8 hours one day and say for the next 2 months, I don't need to brush my teeth. No, it's the same, you exercise, you move, you go walk, you do little 10-minute exercising. Someday you do some stretching, and that takes care of a lot of your health. And when those muscles, because you use muscles to be physically active, so when those muscles, when you hurt, it's always the muscular system. And who's the best professional to see? I'm telling you, you should never have the first thought when someone hurts and you're not figuring out what's going on. You should never think first as referring to the doctor, to the physiotherapist, to the osteopath, to the other therapist. You should be aware of basic, simple stuff to do on your side first. And that's what this training will be about, teaching you the basic of biomechanics and how powerful it is to make the muscular system, joints and bones recover and live pain-free. And that's how you could also educate your patients, your clients, to take care of themselves. So they will refer you tons of clients, the brothers, sisters, friends, family members, all people they know that have pain problems. And you'll find out pretty soon that fixing pain helps fixing other issues, health issues in the human body. Okay, that's enough for today. Broken system, we can fix that, disrupt that system by bringing results like no one has ever seen before. Thanks to be there. I'll see you soon.